Happy week of Christmas. Taylor here at UVA NICU to talk about car seat safety and our practices that we do at this hospital. This is a simulated education for our nursing staff. So we've got a lovely car seat here, and we've got a lovely baby model named Baby Magnolia, and her parents are very excited because they get to take her home soon. And so they have brought in her car seat because she qualifies for a car seat trial. Babies that qualify for a car seat trial here at UVA are born preterm, so less than 37 weeks automatically need a car seat trial, or any baby that needs to go home on respiratory support, as well as any baby with any kind of malformation or disorder that might cause airway issues, floppy neck like Pierre Robin, trisomy 21. So it's a little nuanced with who might qualify, but we have those written out in our car seat guideline in Lippincott, so check your resources. Okay, so the family brings in this lovely car seat, and the first thing you need to do is to check it all over. Make sure it is a appropriate car seat for the car seat trial. Because the worst thing to happen is that the car seat trial occurs and then a different nurse comes on to discharge the baby in the next day or two, and they're like, oh, this car seat isn't adjusted right or is expired, and then the family's ready to go home and they can't because we have to start a whole process over. So do your due diligence as soon as the car seat lands in the NICU and check it over. So hopefully you're gonna see some nice manufacturer labels. We have seen an uptick in counterfeit car seats, so make sure that it looks like a legitimate car seat. You wanna check that it has appropriate manufacturer labels here as well as sometimes on the underside, it will tell you the manufacturer date. It might be up to you to check online the make and model to make sure that it is still in date. Most infant car seats are good for the 7 to 10 year period, so if you're well within that, you don't need to check, but if you're kind of on the cusp, you might need to check for the actual make and model. Other things that might indicate that your car seat is counterfeit is this stitching here is really great. It's like really reinforced, and when it's counterfeit, you might just see a little square of stitching or an X. It's not very secure. Coming back here, you might see a 3-point harness instead of the recommended 5-point harness. So it will come down in a V to the crotch area instead of having a chest clip. So that's a huge red flag as well. And then you might also see, just like it feels cheapy, like the cushioning and styrofoam is a little bit chintzy. So just do your due diligence upon getting the car seat to make sure that it's appropriate to use for going home. If you have twins, they cannot share the same car seat. Each one needs its own car seat to go home in. So make sure that you're doing the trial in the car seat that the baby is actually going to use. We are seeing a lot of products that come with the car seats. It is okay to use the products if it came with a car seat for positioning, only if it adds to the baby's correct positioning in the car seat. So like this one tends to tilt the baby's heads forward, and so I would say don't use it. There are other ones that come aftermarket, and those are not recommended to use if they did not actually come with the car seat. So please advise your families as such. And as we are getting into the winter months here, it's important to educate the families on properly dressing the infants to stay warm, but not too bulky to create too much distance between the straps. So reinforcing that education here in the NICU is great. No winter coats, no little bunting snowsuits. We can optimize blanketing after the baby is secured in the car seat. Okay, so we've done our due diligence. The car seat passes the test. We are ready for the car seat trial. First, we need to make sure the straps are properly positioned for Baby Magnolia. So you want the shoulder straps to be at or below the level of the shoulder. So let's see how this fits her to start off with. Well, I can already tell without even going further that the strap is ski sloping down. That's a no-no, not safe. The baby has an increased risk of slipping out of the car seat. So we're gonna have to take her out, have mom or dad hold her. If they're not present, you can put her safely back in the bassinet. Put her safely somewhere because you're gonna have to do some minor surgery on this car seat. So some have a single track here for the shoulder straps where when you're tightening, it just moves up and down depending on the patient height. Awesome. Some do not, and that requires you to do a little manual labor. So the parents are going to have to learn how to do this as well as the baby grows, because they'll have to continue to advance the straps as long as the baby meets the height and weight requirements of the car seat. So for this one, baby's out, safely positioned. We have to take this metal plate here and unhook it from the strap. And then feed it through the hole into the lowest hole. So we're doing that here and here. Great. Now we need to reattach the metal clip. So this is the standard loop that it was just on, but for our smaller babies or shorter squatter babies, there is actually a hidden secret loop right here that makes it a little tighter. So for our baby Magnolia, I've already tried this out. So I have saved the work of having to do this multiple times. But this one, the strap will be as tight as it can go and it's still too loose. So for baby Magnolia, we're going to need to use this secret tightest strap. And again, as baby grows, you might have to coach the family on how to adjust the metal plate here. The other adjustment that might be needed is the crotch buckle. So if the car seat comes and the crotch buckle is secured the farthest away and the baby is small, then you will have to remove it and feed it through the tightest area there. Okay, so we've optimized making the things as small as they can go. She does meet the minimum weight requirement and the height requirement. It's different for every car seat, so some do go as low as 4 pounds. So make sure that if you're sending home a smallish baby, that they do meet the weight requirement for the car seat. All right, so baby Magnolia, she is ready to get into her seat. I recommend starting with the bottom clip here over the hips, because this really is hard to adjust. There's not a lot of wiggle room there. It's as tight as it's going to get. So starting down here. Now she has a lot of room between this buckle. The only time that you are allowed to insert something between the strap and the baby is for this little towel blanket to form a U between the crotch strap and baby's legs. So you want to take up all the extra room with this U, and as they grow, you will need to take that out. But for now, she needs that. Okay, so we're optimizing the clips here. We are gonna belt her here, and then we are gonna tighten using the strap. The chest clip should be at armpit level, so right where the armpit starts. And you wanna make sure that you cannot do this pinch test. So if you can pinch the straps like this, it is too loose. If you can stick more than 2 fingers under the chest clip, it is too loose. So continue to tighten, which means you might have to adjust the chest clip down each time as it rises when you tighten it. So you can see that this is now, maybe you can't see, at the level of her shoulder. And then as she grows, it will continue to go under the level. And then when it becomes too tight, the family at home can then upsize and do what in reverse what we just did. Okay, so I've tightened it. We can no longer do the pinch test. We can no longer stick fingers under the chest clip, but her head's kind of floppy. So they get some free hospital blankets to go home with them. These can get positioned on either side, kind of under their shoulder and hips, but not between baby and straps ever. So on either side, Magnolia gets a little securement here. And this is looking good to go. It's cold outside, so like I said, if she's going out, you can optimize blanketing on top. You can even use those zipper things as long as you're not covering all of baby. For the trial, we don't necessarily need to put an over blanket. Okay, so we've showed the family the proper positioning, the strap position. Another worst thing to happen is that the straps are positioned differently for the trial. A new nurse comes on to discharge baby and is like, surely they didn't adjust the straps. And then they have to readjust the straps to the right way and then repeat the trial. The family gets angry because delayed discharge. So do it right the first time and you'll be good to go. All right, car seat trial we're ready for. Each car seat either has a red level line or an actual level with that bubble thing. And you need to make sure that that is level with the ground. Infant car seats should not be trialed with the base. The base should be installed in the parent's car or whoever's taking them home. So this is not exactly level, and so this is when you can roll up a blanket or a towel underneath to get it at the proper level. Doing it at an improper level is not really an accurate car seat trial. Okay, so we're at the right level. We need to do a car seat trial for 90 minutes. That is the minimum time frame. Up to 2 hours if the family lives 90 minutes away. So you're gonna optimize the timing by doing your baby's set of cares, positioning them correctly, and then you need to directly visualize them for that whole 90 minutes, which means that's not the time to set it and forget it and go to lunch. You want to be monitoring not only their vital signs that are monitored, but how they're tolerating it. So how's their breathing? Is it labored? What's their color like? And all of these things are in our car seat documentation flow sheet in Epic. And it is vital that you're documenting not only your vital signs every 15 minutes, but those extra rows about tolerance, like their respiratory status and their color. If any of that is missing, it has to be repeated. So please do your due diligence and document Q 15 minutes for that 90-minute minimum and how they're tolerating it. Okay, so you have other babies to do. This is the best time to practice your delegation skills. Call one of our techs. Hey, can you go feed that baby over there so I can be in this room to watch this baby? It's especially difficult in our private rooms because you're in there for 90 minutes. So optimizing the helpers that we have in the unit to make sure that you're doing the correct thing for the baby. Because if you're seeing them desat on a monitor and you're not there, you're not really gonna understand what went on. So passing and failing. They pass if they don't have any event that is 20 seconds or longer. So 20 seconds is kind of the time mark where if they act a fool, they fail. So if they bradycardia, if they have a desat that's prolonged, if their breathing is super labored, if their color changes, for anything 20 seconds or longer, that is considered a failed car seat trial, and you will document that appropriately, alert your LIP, and then you can repeat it in 12 to 24 hours at their discretion. You can also repeat it sooner if the LIP asks you to. So if they come over and are like, hey, actually those straps were a little wonky, can we reposition baby and do this next care set? They're really supposed to go home tomorrow. I think it was a strap issue. You can repeat it the next care time. But if that's not the thing holding the baby up, 12 to 24 hours is kind of the standard, and that is what is written in our lip and cot guideline. If you have any questions, you can reference the car seat trial course flyer in the bathrooms. I can give you a handout myself, and it was attached to our bi-weekly newsletter Friday footnotes if you do have questions. So key points, make sure that you've got a 5-point harness. You are gonna have the parents watch the car seat safety video. It recommends rear facing until at least 2 years old. If they do bring in a convertible car seat and not an infant car seat, that's totally fine as long as the baby meets the minimum weight and height requirements. It's just a little bigger and bulkier and not as portable, but same directions apply as well. Make sure that you're checking things over as soon as the parents bring in the car seat and not waiting until it's time for the car seat trial so that they can get a new one if it's expired or if it's a dupe. And then understanding what babies do meet the criteria, so you can check your lip and cut guideline for that. Also new is that you no longer have to wait right up until the last moment to do the car seat trial. So there is no expiration if you do it and the baby is like meeting what they need to meet to go home. So if they still have an NG tube, but they're on room air and they're going home on room air, it's okay to do the car seat trial. Don't perform it if the baby's on cannula and you think the baby's not gonna go home on cannula, because then they need to repeat. But if the baby is going home on oxygen and they're ready to go except working on feeding, you can do it a week ahead of time and it does not expire. So we no longer have that 72-hour window of protected time for a car seat trial. If you have any questions, please feel free to email me. While I am not a certified car seat technician, I have taken the Safe Ride, First Ride Safe Ride training here at UVA. I'm a mom of 2 and have discharged hundreds of babies in different car seats, so I'm able to help troubleshoot as you need. But if you have any questions in the moment, please reach out to one of your charge nurses and they'll help you get baby ready to zoom out of here.